Thank you for joining this next COPD webinar on breathing better. Today we're joined by Claire Cook, physiotherapist and NHS England South West Respiratory Lead and Clinical Lead of Community Respiratory Services in Bristol, and Dr. Steve Holmes, GP and NHS England South West Respiratory Lead and Somerset CCG Respiratory Lead. I would pass over to you two. Thank you.
Thank you very much. I'm Steve, and it's a great pleasure to work with Claire today, going through some of the issues that I'm sure are very important to you as somebody with COPD. And probably the first thing is to think through, Claire, what sort of things will help me to breathe better?
So first of all, have a look at thinking about our medication. So the main route of our medication for COPD is through our inhaler. Whereas unlike taking a tablet, we need to be a bit more considerate about the technique we use for making sure we get our medication correctly into our body. It's really important that when we get new inhalers, we take time to learn the correct technique and take time throughout the life of using our inhalers to refresh and revise the correct technique, checking in with our healthcare professionals in our GP practice, in our pharmacists, and other healthcare professionals we meet along in community services. It's really important that we think about we're using one of the two techniques, and that's that our breath is either hard and fast or slow and steady. And we can ask our health professionals to help us revise these techniques and refresh, ensuring we've got the best technique to get the medication into our lungs.
So I often see people wandering around town using a pump action inhaler and breathing in really quickly and hard through it. I'm sure that's not right, is it, Claire?
No, that's right. We've got two techniques, and with that pump action inhaler, the one where the propellant comes out quickly when we press the button, our breathing style needs to slow that down. So the way we get the best spread of the medication across our entire lung fields is to breathe slow and steady. It's important with this type of inhaler to use a spacer, shown here in this picture. What this does is it provides time for us to slow down the medication, slow down our breathing, and do deep, repeated breaths to get good spread of medication.
It's not all about medications though, is it, Claire? There must be some things I can do myself if I'm feeling breathless to help me to feel as though I'm breathing better.
Absolutely. It's really, really vital that when we get a diagnosis of a long-term condition, particularly one with respiratory components, is that we take this opportunity to increase our activity, to take up new hobbies and habits, to maintain our activity. This is not an opportunity to stop exercise. It's an opportunity to think about how we can maintain a good health and fitness and good physical activity. By doing this, we actually reduce the effect and the experience of breathlessness. Our muscles become stronger. We use less oxygen, therefore we're much more efficient in the way we move. Because of this, we experience less breathlessness when we're moving, and this enables us to feel better and to do more. By being active, we experience less of a burden from our disease. It doesn't change our diagnosis, but it certainly changes the way we live with our long-term condition.
That's brilliant. So what you're telling me is if I have a problem with my lungs, actually the more I do and the more I work on getting fit and making my lungs work harder, the more I'll be able to do for myself.
Absolutely. And it's really a situation where you reap what you sow. And the earlier you take up these habits, the easier it is to maintain them. Waiting till our symptoms become more symptomatic and the burden on our life becomes heavier makes it hard to take up exercise. So the time to start really is now. Many people increase their activity and are more active after their diagnosis than they were before. And that's an excellent role model.
I've heard a few people talking about other sort of courses I can get involved in to help with my breathing. Is there any benefit from these?
So yes, the title we hear is the Pulmonary Rehabilitation. So pulmonary means lungs, and rehabilitation is the process of getting better. Pulmonary rehab is a short course that you'd often attend physically. So you go to a health centre or you go to a gym, or you can do them online. And they're led by healthcare professionals, physiotherapists, nurses, occupational therapists, sometimes dietitians, and they give us health information and exercises so that we can improve our self-care and our physical health with our lung condition. So it's often spread over 6 weeks. We might attend twice a week, and it's broken down into modules of information, and they all centered around understanding our condition better, being more confident with our self-management, thinking about the other factors that help us live well with our disease, things like healthy diet, activity, and understanding how to navigate the healthcare system.
I'd need to go to that for a few weeks. Is it really worth it?
Absolutely. The scientific evidence that underpins pulmonary rehab is exceptionally strong. It reduces our length of stay in hospital. It reduces the probability of us becoming unwell, and also it increases distance we can walk following that course of activity is significantly longer for the majority of people who partake in the programme.
Sounds great. If I was looking for some information on that, what should I do?
So many services you can self-refer to, and there'll be information on your local health website. And if not, your primary care, so your COPD nurse or your GP can refer you.
Are there any simple tips that I can use when I'm going around in my normal activities to help with my breathing? It might just make that difference when I do feel a bit breathless, because I know that quite a few of the people that I see can feel a bit embarrassed if they're more breathless than other people.
Absolutely. Breathlessness is not a normal part of aging, and it can be a really tricky symptom for people with COPD to manage. As we said before, it is really important that we maintain our activity, and breathlessness is a normal part of being active. But we appreciate for people with COPD, at times this can become quite overwhelming and quite notable. What we want to talk through here is just some simple techniques we can use so that actually we have better control of our breathing when we're exercising, and that means we're able to do things for a little bit longer. When walking, it's really important that we plan our route and plan where we might plan some stops along the way. Stops can be things like leaning on a lamppost, resting at a bus stop, resting our bottom on a low wall, and allowing us to catch our breath so that actually we have periods of being more breathless, then we recover, then we go again, then we recover, and then we go again. It's helpful to plan things like the route we're taking, so avoiding steep slopes where possible, or maybe getting off the bus one step further and then walking down the hill to our destination rather than tackling the hill on a tricky day. Something we can do when we're climbing steps or stairs is a technique called blow as you go. And that's really focusing on our out breath and breathing out through pursed lips and breathing out on the activity, allowing our breath to rest, and then breathing again. This might mean that a flight of stairs we need to break down into 3 or 4 parts, but that is very valuable exercise and will help with our overall health. We also know that our breathing is affected by our mood, particularly if we're feeling anxious. That can be about our health or because we're in a challenging situation. It's really important where possible not to focus on the speed of our breathing, but to turn our attention to the out breath and lengthening that out breath where we can and allowing the breath to naturally come in and blow the breath away. Sometimes when we're eating and drinking, we can have problems with our breathing. And that's because we're changing the pattern of the way we're breathing when we're eating. It can be that we're eating things that are hot or cold, and that can change the way we breathe. Or actually, when we've got that feeling of a really full tummy, it's actually harder for us to control our breathing. It might be that we need to think about eating meals small and often, and maybe not challenging a 3-course meal, but picking 2 a starter and a main, and eating small portions throughout the day. Planning our daily activities is part of living with COPD. Can only plan daily is sometimes how patients describe living with COPD. It's important to think about planning, preparing, and pacing our activities throughout the day and throughout the week, so that when we're doing things that are challenging, we're not doing those things all in a run of days on the block, or that we're doing things and then creating a real boom bust culture. I'm sure lots of your patients talk about how actually they've learnt the hard way by doing too much and then feeling really exhausted for a couple of days afterwards.
That's really good. Thank you very much. Lots of really good tips there. So are there any simple ways that I can use myself to help me feel less breathless, to help me to control my breathing?
Yes, so these are some terms that you'll hear people describe, and they're techniques to help us focus on our breathing and to gain better control of our breathing. So one technique we can recommend is something called tummy breathing or breathing control. It means you can control your breathing to breathe with the least amount of effort, and you can breathe slower and more gently. It's also really efficient because it uses the diaphragm, which is a large muscle that sits between the chest cavity and the abdominals. And this is our most efficient muscle to use with breathing. We want to get ourselves into a relaxed position, either sitting or standing. It often helps to place your hands, as shown in this picture, one on your chest and one on your abdomen. The purpose of this breathing is to get us to breathe in slowly and deeply, which will cause our hand on our belly to rise while the hand on our chest remains still. This means that we're deep breathing with the bottom of our lungs and breathing as efficiently as possible. When you gain control, it's often helpful to close your mouth and breathe in through your nose and let your out breath just fall out when it's ready. So breathe out naturally. Don't force the next breath. And what you'll find is that your breathing pattern will slow naturally over time as you practice this or as you recover your breathlessness after you've done a period of activity or you've had a period of anxiety. Another technique we can go on and do after we've used breathing control is box breathing. This can help us to focus our mind on something else. And it's described as box breathing because we go round the box. What we do is we breathe in on the verticals, breathe out on the horizontal, and breathe in on the vertical. And we just follow the flow round, focusing on the in and the out. Again, the speed at which you're doing this will gradually slow down as you gain breathing control. And the handy thing about a box is that you can find one of these wherever you are. So you could sit in the doctor's waiting room and your eyes could scan around a poster. You could scan around the television or a picture on the wall. And it will help you just to focus in on your breathing and try to drown out some of those crowding, busy thoughts we can have when we're feeling anxious. Something else we talked about when we were talking about being out and about was the position we're in. When we're feeling really breathless, it's helpful for us to support our upper body. And this can be by creating a tripod position with our arms. So we lean forward on our forearms. You'll see people do this in hospital, leaning over the hospital table. We can do it in our kitchen, standing at our kitchen work surface, leaning against a wall. And it just means that we've got a nice fixed supporting position for our breathing, for our rib cage to work and our breathing to slow down nicely. The more muscles we're using, the more energy and the more oxygen our body's demanding. So being in a position of being sat down and well supported, resting our bottom against the wall, leaning sideways against the lamppost, taking the weight of our body will help us to use less energy and help us calm our breathing. Another technique we often recommend is something called fan therapy. This is when you use a handheld fan with batteries in it or a fan that's a table mounted fan. And this is to change the airflow around our face, which means it reduces the sensation of breathlessness. It's important you have something that's got 3 blades because we want to create quite a lot of air movement. You want it to be within about 6 inches or 15 centimeters away from your face. And you want to have the fan generally blowing directly on you. This means that passage of movement of air will go into the front of your face between your nose and your mouth. And this is where you've got some receptors that will pick up on that airflow and that will help us have a passage of air over the lips, which will help reduce our breathlessness. There are things to consider when doing this out and about because actually that movement of air is also changing the molecules that we're breathing out. So if we have got an infection, this is something we want to do at home and when we're alone and not with other people.
And sometimes people with COPD can find they've got quite a significant cough and find it difficult to bring up any phlegm. Are there any ways that you're aware of that can help us to bring up phlegm if that's difficult?
Absolutely. So, unfortunately, for many people, phlegm is a normal daily part of living with COPD. Some things we need to consider is that actually we keep an eye on our phlegm as it's an indicator of when we're becoming unwell. But for many of us, it is a normal part of day-to-day life living with COPD. Things that can help our phlegm is to make sure we stay hydrated so that our phlegm is loose and easy to clear. And also that actually activity is a really good way of clearing our chest. So that natural deep breathing we do when walking is a great way of getting our chest clearance sorted. There is a specific technique which is called the active cycle of breathing. This is quite a lengthy technique to describe and actually is a really helpful leaflet that we're going to put in the further information handout section. One provided by the Association of Chartered Physiotherapists in Respiratory Care is one that I'd recommend we look at. The way we describe this is a progressive cycle of changing our breathing pattern, which helps the secretions to be mobilized up our airways. So the phlegm moves from the lower part or middle part of our airways up to the point where we can cough it out. It's made up of that breathing control, having nice control over our breathing pattern, then doing some repeated deep breaths, about 3 or 4, and repeating this cycle a couple of times. Then we try a forced technique called a huff, where we expel the air quickly from our airways, and then that can lead to a cough. What this does is it gradually, progressively clears the secretions from further down the chest, which then means we bring it to the top of our mouth and then we can cough it out. This is something you want to practice a few times before you get the technique, and something that you want to do, most patients find useful if they practice it every day to keep their chest clear and to keep the technique good, and something you'll increase doing if you're unwell with your chest and you're experiencing an infection.
Thank you very much, Claire. And please remember that you can re-listen to this webinar as often as you like. And I just want to summarise. So what Claire was saying was really use your inhalers correctly with the correct technique and use them regularly. Increase your activity. Don't use the diagnosis as a reason to reduce your activity levels. Activity actually makes your muscles grow stronger, helps you use less oxygen, you become less breathless, and you're actually able to do more. She also mentioned pulmonary rehab courses. Ask your medical team to refer you. Pulmonary rehab results in shorter stays in hospital, less illness, a better physical ability, and you're able to walk further. So it's really worth doing. Listen as often as you need in order to learn about the breathing techniques in this webinar, and listen to learn ways to control your breathing. And finally, listen to learn simple ways to bring up that phlegm. Keep hydrated and active, and that'll help loosen the phlegm. So all extremely useful information from Claire today. Thank you.
That's been fantastic, Claire. Thank you very much indeed. There's been a lot of information that we've covered in this short webinar, but as you mentioned, the further information handouts are available, and it's worthwhile having a look at those too. So thank you very much, Claire.
Thank you for taking the time to have a listen. Check out those resources and hopefully we'll see you in pulmonary rehab soon.